Well, the Western Cape is officially in its fourth wave, and this means an increase in infections, hospitalisations and even deaths over the coming weeks.
Now, the Western Cape health authorities are pleading with people to get vaccinated in order to avoid as devastating a fourth wave. Ayesha Ismail reports.
They've brought people to vaccine sites and have taken jabs to the people. Pop-up sites in malls and workplaces, and about 200 fixed vaccine sites across the Western Cape. But still, Western Cape health authorities say they are falling short of their vaccination targets.
I think, unfortunately, there's still a lot of misinformation that people have access to via social media. And people are reading this, and it's really unfortunate that it does have an impact on people's decision on whether to vaccinate or not.
He says it's disappointing that people in positions of power, like some religious, traditional and community leaders, are spreading misinformation and fake news.
And it angers us as medical professionals when we see this happening from colleagues and from influencers within the communities.
To counter this, he says the department is constantly putting out accurate, scientific and credible information. Areas of concern include Khayelitsha and Mitchell's Plain, where the vaccination rate remains low.
The people is actually very fearful to go for the jab because of things they listen about the jab. The one person to a different person gives them false information about the jab. And the majority of people is aged people with comorbidities, lung failure sometimes, asthma, arthritis, diabetes. They're all worried of their comorbidities. Should they go, what's going to happen with them if they take the jab?
But one community leader believes that besides ignorance, the medium is the message.
There's a very forced drive by the anti-vax groupings, and they drive very easy to drive type messaging, and the worry is that they would seem that the government side and the pro-vaccination side is dependent on traditional forms of communication.
He says the department must get with the program and make use of more social media platforms to get the right message across. And this is exactly what he's doing. Ayesha Ismail, Khayelitsha.